Live breaking news from your local news channel.
Good afternoon. Thanks for joining us for the special report. I'm Beth Farnsworth. The Santa Barbara County Public Health Department is providing its weekly update on the COVID-19 pandemic. Let's listen in now live.
Continue to post a disclaimer on the county data website indicating the numbers posted are incomplete and cannot be relied upon at this time. The more than 2-week gap in reliable case data has led us to shift focus from the daily positive case numbers to the available local hospitalization information. All our local hospitals have continued to be reliably, consistently, and accurately counting the number of COVID-19 positive patients in local hospitals and intensive care beds throughout the pandemic. The reported local hospitalization and ICU bed counts have been fairly steady for the past month. Over the last 30 days, the total number of COVID-19 patients in local hospitals has been rolling within a fairly tight range from a low of 74 in mid-July to a high of 88 on August 4th. The number of COVID-19 patients in local hospitals today is 73. Similarly, the number of COVID-19 patients occupying intensive care beds in our local hospitals has fluctuated in a tight range over the past 30 days from a low of 24 in late July to a high of 31 this week. Today, the number is 26. This local hospitalization data clearly indicates we continue to have a problem with community transmission of COVID-19 throughout Santa Barbara County. Hospitalization and intensive care patient counts are lagging indicators of the presence of the disease because it takes time for the course of the virus to progress to the point where patients require hospitalization. Without accurate information from the state testing labs on the number of new COVID-19 cases identified daily, we are flying blind about the current level of community transmission. It's very important the state resolves this data gap as soon as possible. Moving forward on any new business reopenings or considering school waivers is premature until we are confident in the state data and ultimately conditions improve locally to make these opportunities safe. The missing COVID-19 case data doesn't change the prescription for fighting the virus in any way. We all need to continue to do everything that we can to reduce the spread of COVID-19 in our communities. How do we do that? Each of us must focus on wearing face coverings in public, keeping at least 6 feet away from other people at all times, washing our hands, and avoid mixing with people outside our households. It's that simple. While we keep our focus on the urgent challenge of the coronavirus pandemic, we also have to begin thinking now ahead about the upcoming fall flu season. The annual influenza season usually begins in October before peaking between December and February. The Centers for Disease Control and Prevention is very worried about what may happen as the coronavirus bleeds into the flu season. The annual influenza season is responsible for between 12 and 61,000 deaths a year and by itself can strain hospital capacity. Influenza has caused 140,000 to 810,000 people to be hospitalized annually over the past decade. Last year, we were fortunate the flu season was relatively mild and had largely diminished before the serious onset of the coronavirus pandemic. We may not be as fortunate this year. CDC Director Robert Redfield warned Wednesday that America is bracing for the worst fall from a public health perspective we've ever had. The problem is we're going to have a COVID in the fall and we're going to have the flu in the fall. Either one of those public health concerns alone can stress our local hospital capacity. We haven't had overlapping wide-scale virus outbreaks at the same time since the Spanish flu pandemic more than 100 years ago. The good news is influenza has a vaccine and a treatment that can keep it under control. The problem is less than half the country, only 47%, got a flu shot last year. The CDC normally recommends that 60 to 70% of the country get the influenza inoculation to keep the virus under control. This year, it's more important than ever to push for much higher compliance. Don't let reports of imperfect flu vaccine efficacy stop you from getting vaccinated this year. The 2017-2018 vaccine's efficacy rate was just about 36%, which means it cut flu-related doctor's visits by that same amount. The flu vaccine can also lower your risk of complications of dying or getting very sick from the flu. Every additional person who gets vaccinated for the flu may prevent the need for a future hospital visit if complications emerge. An avoided hospital visit keeps the hospital bed available for a potential surge in COVID-19 patients that require hospital care. Flu shots will be available free of charge beginning in September at county health clinics. You can also look up our state's free and discounted vaccine offerings at vaccines.gov. Please plan ahead now to get vaccinated for the flu as soon as possible this year. We are all eagerly anticipating development of a COVID-19 vaccine that will create a path to get back to our pre-pandemic lives. In the meantime, we have a vaccine ready this year for the flu. Do your part and get vaccinated soon. Next, we have Dr. Vonda Reynoso, Director of the county's Public Health Department.
Thank you, Supervisor Hart. I'd like to begin by taking a moment to pause and give thanks to our entire community for remaining vigilant in our collective efforts to flatten our local curve. You have continued to remain engaged and have adapted as we've learned more about this virus. That is no small feat. Your role in the fight against COVID-19 cannot be underscored enough, and we thank you for your ongoing efforts. Today, we are reporting 137 new cases. We currently have 290 cases that are still infectious in our community. Currently, 73 people are hospitalized, with 26 in the ICU. Our total case count stands at 7,274 today. We unfortunately are reporting 2 additional deaths today. These individuals were both over 70 years of age. One person had underlying conditions and resided in the Santa Barbara and Mission Canyon area. The other person did not have underlying conditions and resided in Orchid. Both deaths are related to congregate living facilities. We extend heartfelt condolences to the families and friends of these community members. Recently, we were made aware that multiple salon owners across Santa Barbara County plan to defy the current state and local health order to reopen their salon indoors beginning Monday. Please know that opening would violate state and local health officer order. It may be considered an unfair business practice and could result in enforcement actions from state licensing agencies. The current Santa Barbara County health officer order only allows salons to operate outdoors with additional safety requirements. Those salons, however, can only offer haircuts and cannot provide services such as hair coloring or shampooing, which generally make up a significant portion of their business. Our health officer order mirrors the state's, as we as a county can be more restrictive but not less restrictive than the state's guidance. We truly do understand the impact of closure on all businesses and are working to ensure that all businesses can open safely. All community members must act to decrease the disease transmission, which will ultimately allow us to be removed from the county's monitoring list. And in order to be removed from the state's monitoring list, our case rates must be cut in half. That means we must have 100 cases or less per 100,000 people. Unfortunately, we are currently above 200. In addition, our case positivity rate needs to be below 8% for a 2-week period. We still have a lot more work to do to get there. Our local epidemiology team is hard at work to reconcile the backlogged cases as a result of the state's previously shared errors in reporting. The case numbers, case rates, and positivity rates published by various websites may not be reliable at this point or be in sync with what is shown on our local dashboards. We hope to have data reconciled in the very near future. As Supervisor Hart mentioned, Once we have verified the data and are confident the state issues have been fully resolved, we will remove the disclaimer on our website. Today, we will be hearing from our County Superintendent of Schools as many of our kids, including my own, return to class for a new school year. At this time, Dr. Ansorg, our health officer, will not be considering waivers until our county rate is well under 200 cases per 100,000 people. This marker is established by the state that helps identify to what extent COVID-19 is being transmitted in our community, and for the purpose of considering school reopening and waiver eligibility. As I mentioned previously, our case rate continues to be above 200, which tells us that there is a high disease transmission in Santa Barbara County. We must make every effort possible to protect our students, our teachers, and our school staff during this time. As we move into the weekend, I invite you to take an extra second to consider how you can protect yourself and your neighbors as you go about your routine. Take a moment to ensure that you are carrying a face covering and wearing it when needed. Maintaining physical distance, like taking an extra step back when having a short exchange at the grocery store. Wash your hands at every opportunity, and stay home when you're not feeling well. Plan for the hot weekend and be selective when choosing your activities to avoid gathering with people outside your household, and at all times, avoid crowds. Thank you.
Thank you, Dr. D'Armenoso. Dr. Susan Salcido, the Santa Barbara County Superintendent of Schools, is also here with us today to share news about the status of K-12 education in our county. Welcome, Dr. Salcido.
Thank you. Thank you for inviting me to speak today. And before I go into data and details, I'd like to express my sincerest gratitude to all students and teachers, educators, school staff, school board trustees, and parents and community partners for all that you're working through and handling and grappling with ever since school campuses closed in March, and now here we are, opening schools remotely. I'm hearing from colleagues and community members, friends and neighbors with children of all ages who've gone through some high points and some low points due to the pandemic and the isolation and from being outside of their routine. And I'm hearing from teachers, from first-time teachers to 25-year veteran teachers, from kindergarten teachers to those who teach in high schools, who have a common concern about doing what's right and doing right by their students and families, and who want to create experiences for engagement and relationship building that can be challenging on online platforms. We hear from parents who are experiencing their ups and downs. They share concerns about how to care for each of their children, each of whom have individual needs. While schools open remotely, an equal number of parents with questions have questions should schools open in person. And we hear from employers who want to know how they can best support their employees who have children in school. This is a multifaceted situation, and while I report on school information next, I acknowledge that it may sound like numbers and data, but this is absolutely about people. I can assure you that every action, every decision and consideration has real children like my own and yours, and real parents like you and me, and real human experiences in mind. With that, I'll now report on the status of our schools. We have over 120 public schools in 20 school districts throughout Santa Barbara County. This week, just under half of the districts in Santa Barbara County have reopened. They include schools in the San Ynez Valley and the Santa Maria Valley. And the other half will open next week, with the final openings occurring on the following Monday, August 21st. At that point, all of our public schools will have reopened. All kindergarten through 12th grade schools in Santa Barbara County, private and public schools, are opening via remote learning only due to the governor's guidance from July 17th. Governor Newsom's guidance stipulated that schools in counties that are on the state's COVID-19 monitoring list are not permitted to physically reopen their schools until the county meets specific health criteria, which we just heard this afternoon from Dr. Vondo Reynoso. Santa Barbara County is on the state monitoring list, along with approximately, at last I checked when it was available, about 35 other counties in California. The state has provided an opportunity for some schools to reopen before the county is off the monitoring list, and that opportunity is afforded through a waiver process. Only elementary schools may apply for these waivers. The waiver process involves an application by the superintendent of the district or a head of school for private schools or equivalent role, consultation with specific school partners, and can only be granted by the Santa Barbara County Public Health Officer after a review of the application, the county's epidemiology, and consultation with the California Department of Public Health. As we heard earlier, the Santa Barbara County Public Health Department will only begin to accept waivers for consideration once the county meets specific criteria for 14 days. And that means at this time, no waivers have been accepted, and all schools must open remotely throughout Santa Barbara County. Now, turning to remote learning. Remote learning in the fall comes with very different expectations than what many experienced this past spring, and here are a few reasons why. First, we have the benefit of now improving upon lessons learned this past spring. Second, we can consider that school in the spring was a response to an unexpected pandemic emergency, and the fall is different in that we've had some more time to prepare. Third, the state has outlined through legislation, SB 98, that all public schools, whether in person, online, or hybrid, must meet specific standards for instruction, engagement, assessment, and attendance during this pandemic. Each school district does create their own schedules and options and what schools look and feel like throughout each day, but all schools must provide a specific minimum amount of instruction each day, and that can be met through a combination of synchronous, online at the same time with teachers and students, and asynchronous learning, where students are assigned independent work. Each weekday will include interaction between teachers and students for the purposes of instruction, tracking progress, and maintaining school connectedness, and will include offline assignments as well. Schools will develop plans for re-engaging absent students, and districts will adopt learning continuity and attendance plans by the end of September. We know that students at Promise, transitional youth, foster youth, youth experiencing homelessness, students learning English, students with individualized education plans who are served through special education, all students deserve to be seen and heard and understood and motivated and supported. We know that athletics, theater and music, science and laboratory experiences, all of these are critically important, and we continue to look for opportunities to bring as many of these experiences for youth as soon as possible. In closing, I would like to express appreciation to the broad range of community partners who provide essential support in the areas of mental wellness, food continuity, internet connectivity, child care, and preschool services, and so many other critical areas. We want to thank the partnership with the Public Health Department and their school liaison with whom we work very closely as they support schools. We are grateful for their work every day, and particularly through these uncertain times. We all want to see students and staff back in our schools as soon as it is safe to do so. We can get there more quickly by following practices that are known to be effective. Wearing face coverings consistently and correctly, maintaining physical distancing as much as possible, washing hands or using hand sanitizer frequently. Getting back to school in person depends on all of us. Supervisor Hart, thank you again for inviting me to update the community today.
Thank you, Dr. Salcido. I'm really grateful for your committed leadership on behalf of teachers, parents, and students in our community. Suzanne Grimacy is also here with us today to talk about the mental wellness of young people.
Thank you, Supervisor Hart. Today, I would like to speak to the impact that COVID-19 is having on young adults. In recent weeks, we have seen the serious and severe complications of COVID-19 not only in older adults in our community, but young adults as well. The Center for Disease Control, CDC, reports that 1 in 4 adults between the ages of 18 and 24 say that they have considered suicide in the past month because of the pandemic. A survey also conducted by CDC with over 5,000 young adults in the end of June shows a surge of anxiety and substance abuse were noted, with more than 40% saying that they have experienced a mental or behavioral health condition related to the pandemic. In addition, many young adults are experiencing an exacerbation of financial stresses. Many are losing jobs on college campuses or other part-time work due to closures. Recent graduates are struggling with the stress of paying back the worry of lack of income and paired with paying back school loans. In addition to financial worries, many students are losing their internships or jobs which are considered to be necessary steps in their career path and are valuable. In Santa Barbara County, 74% of total positive cases are under the age of 50, with nearly 8% being children under the age of 18. And over a quarter of our total cases are between the ages of 18 and 29. Nearly 40% are between the ages of 30 and 49. It's clear that our young adults are contracting COVID-19 at an alarming rate. But why? Here are some possibilities that have been shared. There's a perception of invincibility among young adults, thinking that one is healthy is relative. Young adults tend not to see doctors as often and therefore are less likely to learn about underlying health conditions until something goes wrong. Underlying health conditions, as we know, can contribute to the impact that COVID has on a person. The social activities of young adults also play a big role. Sporting events, parties, concerts, bars, restaurants, beaches, and large gatherings with friends are a norm for young adults and where social connections are made. All of these activities are known to increase exposure to the virus. Adults who are more aware of underlying health conditions tend to be more aware of their limitations, and they're taking safety precautions against COVID-19. Young adults are in large tending to stray from wearing face coverings and socially distancing. As we continue living life within a pandemic, we have found yet another area we simply must change our thinking on. Young adults, often pre-symptomatic or mildly symptomatic, not only are contributing to the spread of the virus, but becoming ill themselves at an alarming rate, both ill physically as well as with mental health challenges. This age group is the largest group to be going out and about in life as though things are normal, and the ones beginning to re-engage in activities in the community. If you are a young adult, please help be a model for others. Help model ways to stay connected and have fun during our current chapter in life safely. Our whole community needs you right now, and we want you to be safe. It has become very clear that young adults can be the key to flattening the curve in our community. If you have young adults in your life, please help underscore this message. If you are a young adult or any age person struggling with the emotional impact of COVID-19, know that you are not alone. Here are some things that you can do to take care of yourself. Find a way to help. Volunteer in the community. There are many opportunities for this right now, whether it's helping with meals or just connections with other people or older adults. Volunteering to tutor a kindergarten through 12th grade student who are really going to need the extra help right now with school beginning remotely. Take care of yourself. Take breaks. Find ways to carve out exercise. Create a schedule for your week that includes safe activities. Keep in mind the long-term health effects that can be caused as a result of having had COVID-19. And talk to others, reach out for support. We have so much support available within our community. And if you need help connecting with mental health resources, you can call the Community Wellness Team at 805-364-2750. Thank you.
Thank you, Ms. Grimacine, for your thoughtful and encouraging remarks. We'll now go to questions from the room. Welcome back, Mr. Fish.
Thank you. Just wondering about testing, getting an update about testing in the county, what the average time is to get a test from saying that you want one to physically taking it, and the average time then to get a result back after taking that test.
Our testing availability has greatly improved. I checked this morning, and we are asking that our community members be mindful about testing. That said, the testing availability ranges from same day to the next day. So at all of our Optum sites, that is available. With regards to testing results turnaround, we're seeing about a 3-day average with high priority testing. So these are the symptomatic, critical infrastructure workers. We are prioritizing those, and we're getting the results in 24 hours or less.
You've been listening to the latest update from Santa Barbara County public health officials saying that the state tech issues and the state data is still impacting accurate numbers coming from our local public health. 137 new COVID cases announced today, a total of 7,274, 73 people hospitalized, 26 in the ICU. Also talking about all schools.
You know, that there could be added problems with the flu season, things of that nature.
Sure. So the Optum Serve sites are state-sponsored, and they will be here until the end of September. However, the county are also standing up additional sites to really relieve the Optum Serve length of getting appointments. So we are standing up additional sites to serve the priority 1 critical infrastructure essential workers.
And those are already up and running, or
They are up and running, and we anticipate broadcasting information about that next week.
And then finally, just a question about the fall in general, as well as schools getting back together. Is there added concern that there'll be more kids of all ages gathering together, even though their schools are not held on campuses, they're all remote? Is there concern that there'll be more of that kind of mixing when you start seeing classmates and things of that nature virtually, or is it, are you projecting it to be relatively what we've seen over the summer? What does the fall look like in that way?
Well, that's a great question, and I don't have an answer as to what people are going to do. We're hoping that everybody stays the course and continues to pay attention to all of the things that we're hoping are making a difference. We don't have concrete data to share with you, but the numbers at the statewide level that the governor has talked about are encouraging, and I think they reflect the fact that folks are trying very hard to do the right thing and protect each other. And I know that is happening here locally, and that people are doing the same thing. So, as long as we're consistent with that behavior and maintain that discipline, despite what the virus is trying to do, we're going to create opportunities, as Dr. Salcido mentioned, for potential change in the school structure and the potential for other businesses to even open. But at this moment in time, today, without that direct daily information that we can count on, we can't say when that's going to be.
That's all for me for now.
Thank you. Next, we'll go to questions on the phone.
Yes, first up, we have Tom Bolton with Newshawk.
Good afternoon. I have a couple of questions for Susan Salcido. You mentioned that there were lessons learned in the spring, and I'm wondering if you could expand upon what some of those key lessons were, and then what changes or what strategies that you've developed because of that.
Thank you for the great questions. I'll say a few things that we have improved upon already because of the spring. One, we know that as soon as we changed to remote learning and distance learning in the spring, we really needed to ensure that all students had devices and connectivity throughout Santa Barbara County. And because we had the opportunity presented itself to be remote in the spring, and here we are again in the fall, we know that we have a very, very high percentage of students with devices, and we are much closer to having all students connected through the internet connectivity. And we still have some room to grow there too. We know that in households when students are home, broadband, speed, all of that's really important for students, as we also have parents who are home, other siblings, and other households who are also online. So that's one area. But another piece was that in the spring, attendance wasn't a mandatory piece of the learning, and now it is. And so when teachers were teaching remotely, we didn't have every student there online, and now we have had time for professional development, a lot of learning. All of our districts have engaged with their teachers for how to teach well in a remote learning environment. So we've had the time to learn from what worked. Oftentimes you have students with, we've all been on Zooms together or on distance learning platforms together, and it's sometimes challenging if you have people with their video all off and you're trying to engage. So we're learning from that. It may not be that we're requiring all students to have their video showing, but now we can have more opportunities for engaging in a classroom online. So those are a couple examples.
All right, thank you. Another area I was curious about is that we've been hearing a lot from parents who work full-time out of the house, and they face a challenge of the supervision and ensuring that their children are participating in schools, and then also what happens to those children in the after-school hours. And I'm wondering what steps are being taken to address those kinds of concerns, because they seem serious and pretty widespread.
Absolutely, it is a concern. It's an absolute issue to have. On one hand, it's wonderful to have businesses opening and individuals getting back to work, and at the same time, if you have schools only opening remotely, who will then be supervising the children at home? And so every family who has a child in school has had to really think through and grapple with how are they going to have child care and supervision for their children. Some parents have some flexibility that they can be home, others don't. And so there's a lot of efforts right now around child care and supervision with partners in the community. We're very, very grateful for many agencies who are wanting to support child care efforts. In some cases, they will be on campus, actually, but that is yet to be completely worked out throughout the county. But we are hearing of the pods. We're hearing about people hiring an individual to come to their house. We're hearing about all of these, and we understand that for parents, their number one priority is to take care of their children, and here they are not necessarily knowing exactly what to do. So everyone is thinking about their options, what kind of flexibility that they have, and what kind of child care options there are. Schools are engaging with external partners. I can't tell you all of them yet because they're not all set yet, but they're engaging with external partners in some cases to provide child care options for community members. And in many cases, because we have educators and school staff who also need to teach, and they have their children to take care of as well. Many of our schools and districts are providing childcare for their employees so that they can focus on teaching and have some care for their children as well.
All right, thank you. And then my last question is for Ms. Grimacy. You talked about the challenges of addressing the younger age groups, the young adults, et cetera. It doesn't appear that, shaming works or just telling them the facts works. What strategies do you think are going to be most effective in convincing that cohort to go along with the program?
Yeah, in our community, if only we had a crystal ball, but what I can say has been reported from many other communities as well as many other countries. One of the best strategies is peers, people that are within the same age group that have influence, even adults that are older than the young adult age group that are respected by young adults that are messaging this out. So what it means for us is we all need to be a part of this, every one of us helping to message out, not just at press conferences and not just with our own kids, but if we're all a part of it, I think that's our strategy.
Thank you, Tom. Next up, we're going to Fabiola Navarrete with Tu Tiempo. Go ahead.
Yes, hello.
Go ahead.
Hey, I just have one question. Have you thought to open a walk-up testing site in Santa Maria where there are more COVID cases?
Yes, we are. We have established a walk-up testing site that is county sponsored in Santa Maria. And as I mentioned earlier, we are hoping to launch it community-wide with explaining the hours, explaining the criteria, all of that early next week.
Okay, thank you so much.
Thank you, Fabiola, and that concludes our questions.
Thank you for those questions. Next Tuesday at 9 a.m., we will resume the Board of Supervisors COVID-19 briefings. This longer presentation format will allow the Public Health Department to provide greater detail about the status of the virus in our community and the steps the county is doing in coordination with other local governments to keep people safe, healthy, and working. The Board of Supervisors meeting is broadcast live on Channel 20 and is always available online at the county's website. Our next press conference will be a week from today on Friday, August 21st at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient in your interactions with others. We will get through this together.